Hello, everyone. This is Senator Joe Vitale from the 19th Legislative District here in Woodbridge, New Jersey. I'm the chairman of the Senate Health, Human Services, and Senior Citizens Committee. And so in that capacity, I wanted to have a public discussion today about New Jersey's vaccine program. And with me today is Department of Health Commissioner Judith Persichilli and Dr. Eddy Bresnitz, who's a former deputy commissioner, but is now back on board as part of the team to help defeat COVID-19 here in New Jersey. And so I want to have this public discussion, talk about when the vaccine is available, where we can register for the vaccine, and what our expectations are in terms of its outcome. And then a variety of other questions that I would like to ask them that we're getting from the public. We get calls literally every day. We get emails from colleagues, from the public, interested in how it is that they can, where it is that they can register for the vaccine. So with that, I'd like to introduce our state's health commissioner, Judith Persichilli.
Thank you, Senator Vitale, and thank you for hosting this discussion and for your continued advocacy to improve and protect the health of New Jersey residents. We know that there is a lot of interest about COVID-19 vaccination in our state. With every vaccination that's given, we come closer to what we call the light at the end of the tunnel, a future better than the present that we live in. New Jersey had its first case on March 4th, 2020, and it's been an incredible scientific achievement that a vaccine became available in the same year. It has given us all the hope, even though the number of our cases continue to climb as we sit here today. New Jersey is using a phased approach to ensure that the limited vaccine available is distributed equitably in the state. Everyone who wants to get vaccinated will have an opportunity to get vaccinated. Our aims for our program are to provide equitable access to COVID-19 vaccine for all who live, work, or are educated in New Jersey. As you know, throughout this pandemic, we have made all of our decisions through an equity lens. We also have a goal to achieve community protection. Some of you may use the term community protection assumes that the vaccine is efficacious and available. And we also have an aim to build sustainable trust in the COVID-19 vaccine and along the way in other vaccines. Last week, we moved to what we call phase 1B. So we are working in a phased approach to ensure that the limited vaccine available is distributed equitably across the state. New Jersey is working step by step to serve eligible populations. We started in December by fortifying our hospitals. New Jersey's plan then continued into our vulnerable populations, long-term care facilities. That is supported by the Federal Pharmacy Program. The Federal Pharmacy Program is a partnership between the federal government and the CVS and Walgreens to vaccinate all residents and employees in our long-term care facilities that have been so disproportionately impacted by COVID-19. Last week, we started moving to phase 1B with sworn law enforcement and fire professionals, and we are now expanding to those 65 years and older and individuals 16 to 64 with certain chronic medical conditions, cancer, chronic kidney disease, chronic obstructive pulmonary disease, Down syndrome, heart conditions such as heart failure, coronary artery disease, cardiomyopathies, obesity and severe obesity, sickle cell disease, type 1 diabetes, and smoking. Vaccine is now available at over 200 sites in our state. Individuals in the categories that I just articulated can pre-register at covid19.nj.gov/vaccine. There are also some points of dispensing not participating in the state's scheduling system, and you can contact that information for those sites. That can be found on the same page, covid19.nj.gov/vaccine. Our goal eventually is to vaccinate when vaccines become readily available 70% of our adult eligible population over a 6-month period. So we want everyone that is eligible to get vaccinated. With the vaccines now available, we are a step closer to stopping the spread of COVID-19 in our state and in our nation. As I said, a brighter future lay ahead of us. But we have to remain vigilant, wear a mask, observe appropriate distancing, and download the NJ COVID-19 app. I'll move it over to you, Senator, if you want to introduce our next speaker.
Our next guest is Dr. Eddy Bresnitz, former Department of Health Deputy Commissioner, and now back on the team, helping the Commissioner and all of us. And just a quick introduction, and I'll ask you a couple of questions, Doctor.
Yeah, thank you, Senator. Thank you for having me on this roundtable. Appreciate that. You had mentioned that I was formerly Deputy Commissioner. It's over a decade ago, if you can believe it. I was also the state epidemiologist. I'm an internist and preventive medicine physician by training, and had the pleasure of serving, actually, I think it was 5 or 6 governors over that time period in state government, and then left for the private sector. Thought I retired in early January and came back into service almost a year now. It's been really nice to be able to make a contribution to basically fighting this virus. So thank you for having me again.
Of course, thank you for that. So the Commissioner talked a little bit about the schedule and how this works in terms of registration and who is eligible, particularly in those early rounds. And there are 2 vaccines that we're using now, we're deploying. It's the Pfizer vaccine and the Moderna vaccine. And I've read recently that J&J is close to the end of their trials and may be applying for an emergency authorization from the FDA soon. But the doses we have now, both the Moderna and the Pfizer vaccines, are 2-dose regimens. Can you explain sort of how this works and why 2 is important, not just 1, and sort of how the vaccines actually work?
So these vaccines were authorized by the Food and Drug Administration, the FDA, just last month, after a very rapid development in 2020. And the authorization was made after extensive review and analysis of the data that came from 2 randomized clinical trials that were conducted by the 2 manufacturers, Pfizer and Moderna. And as you pointed out, both of them are 2-dose vaccines. The Pfizer vaccines are separated by at least 21 days, and then the Moderna vaccine is separated by 28 days. The technology is novel. It's on what's called a messenger RNA platform, but they're very similar. And the results from the trials were pretty similar as well. They had about 95% efficacy for preventing COVID-19 disease. And the 2 trials together had about 75,000 individuals, half of whom received one of the vaccines and the other half received placebo. The reason for the 2 doses, to answer your question specifically, is because what you get with the first dose is what's the priming of the immunologic system. And after about 2 weeks, you begin to see the response in preventing disease. And in fact, for both vaccines, before the second dose is given, it looks like the efficacy is about 52% with both vaccines. But then with the second vaccine, which is a boost of the immunologic response from the first dose, as the data was reported out, it was about 95% efficacy. And that efficacy was true even when you looked at a subgroup analyses, such as looking at various ages or race or ethnicity, or whether people had underlying medical conditions. So a very, very robust immunologic immunologic and efficacious response. Why 21 days and 28 days? The 2 vaccines are not exactly the same, but they're pretty close. And so the manufacturers in the development process decided on those intervals in conjunction with the Food and Drug Administration.
So let me just try to boil this down for people like me to understand the science of this. So the first shot begins to help the body build this immune response and antibodies against the virus, and the second shot builds upon that. So that at the end of 2 weeks after the second shot, or 3 weeks, you can correct me if I'm wrong, your body should have what is maybe a maximum response or maximum antibody response to the virus.
Yes, it's about 1 to 2 weeks after the second dose. But I want to also say it's not just an antibody response. There's also other immunologic aspects that are also enhanced from a memory perspective, and so it's a sort of all over immunologic response, not just antibody response. And one thing we don't know just yet is how long that response lasts and how durable the vaccine is, because the data that was submitted and led to the authorization only included about 3 months of follow-up for individuals for on the average. But with time, we'll basically see how long the vaccine is durable.
So with a typical seasonal flu vaccine, we have 50-60% efficacy, right? When you do one every year, like I do, and like you do, I'm sure. This is 94 to 95%, but it doesn't mean that it's perfect, right? So even if it is that we get the vaccine, we get our second shot, it's a month later, and there's 95% protection, we still have to be concerned about what? The transmission of the virus to others. You may have the virus, but you don't have any symptoms, and you could be transferring it to others. So what do we need to continue to do after that second shot?
Yeah, that's a great point, Senator. The individuals who get vaccinated may still actually acquire the virus, for example, in their throats or in their noses. And that virus may still be transmissible to other people. We don't know yet whether these vaccines prevent that transmission. And so although you may have 95% protection, and that's not 100%, it's 95% overall,
pretty good.
You still may be transmitting that virus potentially to other individuals. So moving forward, even if you've been vaccinated, until public health officials say that you should stop wearing a mask and you should stop physically distancing and so on, it's going to be the recommendation that even people who've been vaccinated and gotten both doses, that they continue to basically follow all those other measures that I just mentioned in order to prevent either acquiring infection or transmitting infection.
Thank you. The Commissioner, we've heard a lot about the seasonal flu and how wearing a mask and the social distancing that we're deploying now has had a positive impact in terms of mitigating or minimizing the seasonal flu. Can you talk about that a little bit?
Yeah, you can go on our website. You'll see the incidence of seasonal flu, and right now most of the state is showing a very low incidence as compared to the same time periods in prior years. I think we look at 2018, 2019, and 2020, and as we've seen internationally, the safeguarding methods of wearing a mask, washing your hands frequently, socially distancing, staying home if you're sick, calling your physician if you need to be seen, has had a positive impact on actual flu incidents throughout the state, which is a really good thing, because last year we had a particularly bad flu season, and along with the anticipated second surge of COVID-19 cases in our hospitals, last year we had thousands of individuals that not only visited our emergency rooms with flu symptoms, but many of them, hundreds of them, ended up in our intensive care units and on ventilators, which we know is exactly what could happen to you if you get hit with COVID-19 in a difficult and different way.
So during this second wave, sorry, go ahead, Doctor.
Yeah, if I could just add, there was actually a report out of the CDC just yesterday, or reported yesterday in the papers, that in fact, it's not just influenza infection that has been dramatically reduced. I mean, it's basically at low incidence everywhere. Other respiratory season viruses and bacteria are also at a historically low level. And as the commissioner pointed out, this is likely due to all the non-pharmaceutical interventions like the masking and social distancing, hand washing, that have led to this amazing reduction in all these other pathogens.
So do you think that after we've turned the corner and maybe life becomes normal again, I don't want to say this year, next year, the year after, where will we think about wearing masks during the winter anyway? Is it something that will develop as a culture? I don't know, but with seasonal flu and these other respiratory diseases and viruses that we can get during the winter, because we're in close quarters, we're in the house, we're sharing, air. Maybe it's something that we'll consider doing. I've talked to friends who said, "I'm going to wear a mask from now on." because you get to mitigate those other things.
Yeah, I would agree. And you know, sorry, just in Asia, that's a culture where people wear masks quite a bit. And I think that's your friend is right. I think I've already thought about that, and I think that's what I'm going to continue to do.
Yeah. Judy, you too?
I think one of the best things that can come out of this is that we're all more vigilant about how to prevent infections, that we realize that viruses and bacteria can affect all of us. And if we become more vigilant going forward, I think it'll be a good result.
Yeah, I think people have said that it certainly makes sense, Commissioner. The vaccines that we're distributing now, we have the Pfizer vaccine is being organized or distributed by Walgreens and CVS. And just give me the process in terms of who's doing the distribution, how it's stored, and who's receiving those from the pharmaceutical, from the pharmacy, the chain. Is it long-term care and veterans homes and others?
Well, first of all, as Dr. Bresnitz shared, both of the vaccines are what they call messenger RNA vaccines, but they have very different storage requirements. The Pfizer vaccine requires what we call ultra cold chain. Ultra cold chain at minus 70 to 90 degrees is only available in approximately 40 plus of our hospitals and at main pharmacies like CVS and Walgreens. So the Pfizer vaccine needs to be distributed to the hospitals that have that capacity and CVS and Walgreens for administration in our long-term care facilities. The actual distribution goes directly from the federal government to the vaccinating sites. So to CVS and Walgreens and to our hospitals. This is Pfizer. We order them every week based on the requirements of what we call the points of dispensing. And that goes into a system called Tiberius, which is the system that the federal government has developed specifically for COVID-19 vaccinations. So by Wednesday or Thursday, our quote unquote, our order goes in. And by Friday, we get returned from the federal government how the fulfillment of that order, whether we'll get all of it or a percentage of it, and what will be delivered directly to the point of dispensing. And then the point of dispensing claims the order when they receive it. And that is tracked through a system that we have eyes on here at the department. For the Moderna vaccine, which can be maintained in regular refrigeration, that goes to all other sites, local health departments, FQHCs, links agencies, Rite Aid, ShopRite, and our remaining hospitals. But the process is the same. We put the order in based on what the local the local point of dispensing tells us, and then the federal government tells us what will be allocated, and then it is sent directly to the point of dispensing.
Yeah, we haven't been doing this for too long so far, but so what's been your experience in terms of what you've ordered and what you've received? Because there's been some concern that we'll ask for 500,000 doses and we'll get half that. So it's certainly, the frustration for some people that they can't either get an appointment or can't get the vaccine right now or this week or maybe it has to be next week is a result, by and large, of not having the product, right? Not having the vaccines. And that's a function of the government, federal government, not releasing as many as we need.
Well, the availability of vaccines is constrained. There's no doubt about it. We do not have enough supply to meet the demand. At the end of December, we received 18% fewer doses than we had ordered. 18%. The first 2 weeks in January, we have received approximately 2% less than what we've ordered, and our orders are quite low. We're getting about 53,000 doses of Pfizer a week and 53,000 doses of Moderna. We could use multiples of that. And when we put the order in, we're noticing it's about 1.5% to 2% lower. than what we would expect.
Is that a function of the distribution chain or the actual manufacturing of this product, the production of the product, or is it just bottleneck somewhere and someone's decided New Jersey gets less and Idaho gets more? Is there a process for this?
Well, we put in our order based on what we expect. We expect that we will get 3% of what is available nationally. That is the percentage of our population as a percentage of all of the United States.
Sure.
And as I just said, we get a little bit fewer than that in January. I think it's a manufacturing, what's coming out of Pfizer and Moderna, the manufacturing process. We have not heard of significant bottlenecks, but Eddy, Dr. Bresnitz is the expert, having worked at Merck in the vaccine area, and he does warn us that there are some manufacturing, could be snafus or delays. So maybe, Eddy, you could talk about that process, because it's really important to understand where these vaccines are coming from.
Yeah, as I mentioned earlier, these two vaccines have been constructed from the same novel technology. But the good news about that technology is you can scale up pretty quickly. And the manufacturers were scaling up even before the vaccines were authorized for use. So that was a good thing. And that was Operation Warp Speed that actually facilitated that. Because under normal circumstances, vaccine manufacturers, when they're developing a new vaccine, will basically stage their development process and won't go to large-scale production until they have confidence that the vaccines will be actually approved for use by the FDA. So they were ahead of the game. But that being said, there was still a lot of infrastructure that had to be developed to basically get to even the scale that we're at now. The manufacturers have predicted what they're going to have in January and February and March and so on, and it increases every month right through the end of June. My understanding between the two manufacturers, there'll be, unless there's any problems, there'll be about 400 million doses produced by July. So that's for the country, and then about half of that number will be the number of people who could be vaccinated, because the 400 million will have to be divided in half in order to give 2 doses to each individual. So we're hoping there are no production problems. I do believe the issue is what's coming out of the manufacturer, not what the federal government is distributing. And as Judy mentioned, they're distributing it to states. They've said this from the beginning, proportionate to their populations. So we don't feel that New Jersey is necessarily getting an unfair distribution compared to Idaho or any other state. At least that's what we're being told. We don't have really view into sort of what each other state is getting, but there's no reason to doubt that statement. When I was at Merck, every so often there would be a manufacturing problem with one vaccine or another that was unexpected for one reason or another. And we're just hoping that that's not going to be the case with this precious vaccine.
Sure. So there are, as much as these two vaccines have been a game changer, there's also hope on the horizon for additional vaccines from different manufacturers. I've read recently that Johnson & Johnson, J&J, is on the verge of announcing or seeking authorization from the FDA, and it's a 1-dose regimen, but it's developed differently than these vaccines. Can you quickly just sort of describe what that looks like?
I think that, well, first of all, yes, we're expecting maybe in the next few weeks that we'll see some data from J&J. This is going to be a 1-dose vaccine. It's going to have more simpler storage requirements, so a lot easier to handle. We haven't really seen a lot of the data in terms of what to expect in terms of side effects and that, but it'll probably be on the same scale as the current vaccines, the mRNA vaccines. I believe it's a vector-based vaccine, and which is, without getting technology involved and without explaining it much in detail, we have with other vaccines like that. So technology is not necessarily new, although there are a lot of vaccines technology. And the advantage, obviously, is 1 dose. Now, it may not have the same efficacy as the 2-dose vaccines that we're currently using. It may be a little bit lower, but then it has the advantage of handling and the fact that it's only 1 dose. So there'll be a trade-off potentially depending on what that final data looks like. The process for review will be the same as the 2 vaccines in use. The manufacturer will submit the file to the FDA requesting probably emergency use authorization. The FDA will scale up very quickly to review the data. They're already probably reviewing some of the data right now. And probably within a week or so, or not more than 10 days, they'll review it. There'll be an advisory committee that will review it and give their advice on the use of the vaccine. And then the FDA will make its decision about its authorization and issue that. And finally, the Advisory Committee of Immunization Practices that advises the CDC will also review the data and make its recommendation on how to use the vaccine. But it will mean, assuming it goes through successfully through that process, more vaccine available to meet the demand, not just in the country, but obviously in New Jersey.
I also think that AstraZeneca is another pharmaceutical company that's in the late stages of their trials as well. So I would suspect that there'll be at least 4, maybe 5 or more as time goes by, which certainly is good news for not just New Jersey, but good news for the world, because there are literally billions of people who need to be vaccinated, and the storage issue is daunting, right? So if it is that you have to, if you want to use the Pfizer vaccine, and you're going to have to apply this vaccine remotely to a country, the supply chain is critical. There's a breakdown in refrigeration, then you've lost all that vaccine. So a simpler vaccine, something that doesn't need that kind of storage, will certainly be helpful for not just New Jersey, but for everywhere else for that matter. I want to just, I have a couple more questions and wrap up. We've had calls to our office about, where we can register for the vaccine. And so the County of Middlesex, where I live, has a website we're able to go on and register, pick a time, pick a day. Now it fills up very quickly, and you have to go back on again the next day or at midnight, but to get in line, because there's just a huge interest. So I would just ask people not to be frustrated, to be patient, that we're all in the same boat. But the Commissioner, in terms of accessing you gave out the covidnj.gov/vaccine link. The counties in which people live, are they able to register for this as well in most counties, or just some?
Actually, all of the points of dispensing can interface with the NJVSS system, and that's the system you access when you go to the link. It's a choice. Some of the counties and our hospitals have their own registration systems. So if you go on the link and you go to the site closest to you, it will tell you whether you have to call that site directly or go to a county site, or whether you can register and make an appointment on the NJVSS site. We're trying to get as many points of dispensing connected with NJVSS, but for obvious reasons, for example, the large hospital systems that are helping with the mega sites, they have their own registration system that's up and running, and they used it for their own employees. They know it works, so you'll go through that system. So there'll perhaps be 2 ways to pre-register and register.
But ultimately, the state will know that people have registered. So all the information goes, it may be initially registered at the hospital, but at the end of the day, that information goes to the state portal as well.
All of the information does. The information in 24 to 72 hours goes into our immunization system, so that we know every dose that's given, lot by lot number, and obviously with the 2-dose regimen, the fact that people are coming back for the second dose. You fill out a postcard when you show up to get your first dose. That postcard is then sent to you, and there'll be other alerts for you to come back for your second dose within the 21-day or the 28-day window.
And that was my next question. That's perfect how that works. Right. So there'll be a communication back and forth.
Yes.
From those who received it. So the information that goes to the website, is it those who have received their first and second dose, or just that they've applied for it or registered for it?
Every dose is tracked. Every dose is tracked.
Okay. Because you can apply for it, but never actually go to get the dose, right? So you want to try. You can apply for the dose, but never actually go and get the dose. But you want to actually have that information who's actually shown up, gotten their first and second dose, so that you're able to then track that. Okay.
We are able to track that at the department.
Right.
And that's important because just based on historically other vaccines that are series vaccines, multi-dose series, people don't often come back for that, second or, depending on the vaccine, third dose, for a variety of reasons, depending on the vaccine, and particularly when there may be, local injection site reactions, which is going to be common with both of these vaccines. People may not want to experience that second, set of reactions. And so there'll be a percentage of people who don't want to come back, and we're going to have to encourage them to basically return. And this will be particularly problematic as the COVID-19 pandemic starts to decline and there's less and less in disease. There may be some disincentive for people to come back because they're thinking, well, maybe there's not a lot of disease circulating in the community. So that'll be a challenge. It'll be a welcome challenge, I will say, because it means everything's getting better, but nevertheless a challenge.
Right. And lastly, just want to talk about the age groups that are eligible for the vaccine, without getting into specifics about subgroups, but is it 16 and older? Is it 18 and older? Does it matter? Does it depend upon whether it's a Moderna or a Pfizer vaccine? And then lastly, I just want to talk about children, but where's the cutoff in terms of the vaccination for young people?
One of the vaccines is 16 and one is 18. Eddie, do you remember which?
Yeah, the Pfizer vaccine, their study was in 16 and up, and the Moderna one was 18 and up. So, and they're both companies are doing studies in younger children as well.
Right.
But they're not approved yet, or they're not authorized yet for use for younger children.
For children, right. So I'm sure that'll be the next thing. I'm sure that they'll develop vaccines for children as well. So I guess, as Commissioner of Health and as an epidemiologist and an internist, we need to make sure that, all of us, the parents and others who have young children in their home, but continue to be protected and masked up because a vaccine does not yet exist for them. And we have seen not just, anecdotal reports, but real life, stories and reports of children who have suffered because of the virus. And not only have they suffered because of it, they're also a vector. They're sort of sometimes a petri dish of being able to spread the virus to others, whether it's through school or it's through daycare or it's just out and about like their families are. They can be vectors for the virus. And so we need to make sure we protect our kids, 16 and under, 17 and under, all the way down to infants, because there isn't a vaccine yet for them. And again, they can be affected by this, and they can also be a transmitter of the virus. So you have closing thoughts on that, and we'll wrap up.
Well, I think you stated it quite clearly. I mean, the good news is that most younger individuals, if they do get exposed and infected, they have mild to moderate disease. There is the one warning that we have 75 cases of multi-system inflammatory syndrome in children. So there is a subset of kids that are getting an inflammatory response that requires them to see their physician, and some of them be hospitalized. It is shown that each of them have been exposed to COVID-19. They either test positive or they have antibodies. So you need to be vigilant with your children, and you need to have precautions. You need to safeguard.
Dr. Bresnitz, any closing comments?
Yeah, I would agree. I think, the interesting thing is that with all the impact that this has had in schools, I would venture to say that families are not having those constant respiratory infections that they get because their children are in school and they bring it home. And that's because they're either wearing masks in school if they're attending in school, or they're not going to school. And we'll see a rebound in that. It also kind of comes back to your question earlier about wearing masks going to the future. One could argue almost that mask wearing could be completely the culture and the norm going forward to prevent all those other respiratory diseases that the children bring home. So I just want to echo what the commissioner said about we need to basically keep doing what we're doing as the population gets vaccinated. Sure.
Well, thank you, Commissioner Persichilli and Dr. Bresnitz, for your time today. I hope this has been helpful for those who view it. And I'm hopeful that sometime in the near future we can get back again and get an update in a few months to see how things are progressing here in New Jersey. But again, on behalf of my colleagues and the citizens of the state, thank you for your tireless work. I know you eat and drink and sleep this. This has been part of your life. You do this 7 days a week, 18 hours or more a day. And people don't know that. I do. And so on behalf of my colleagues and our citizens, thank you for your commitment and the work you're doing to help save our lives here in the state. Thank you again.
Thank you for your support.
Thank you.